Hello everyone, Ashley with Amare, and today we're going to talk about whether you need to prepare for surgery pre-op and what that means. So based on if you're having a lipo procedure, tummy tuck procedure, BBL procedure, or maybe even a hysterectomy or breast cancer reconstruction, but we're going to talk about, do you need to prepare for surgery? What is important to prepare? So you guys hear a lot of these things on the Facebook groups, the Instagram, telling you to get Juven and fajas and garments and all these different things, but what is really important about preparing for surgery? Yeah, there's a lot of nutritional advice out there and stuff, but what does it actually mean to prepare for surgery, and what do we need to do that, and how do we need to do that based on the procedure? So no matter what procedure you're having, you need to start thinking about the things you're going to need before surgery. This is why you come in for a pre-op with me before surgery. We offer pre-op sessions. So what that includes is a little bit of the massage, 15-20 minutes, so that you can actually feel how gentle it is and how it's going to feel after surgery. But a lot of the time we spend talking about what you guys actually need. So little things that would help make your life a lot easier. So I know a lot of people kind of get and we have them, the female funnels that would make your life easier, the little things. Maybe they'll tell you to get incontinence pads so that you don't leak all over the bed, or a shower curtain and things like that, right? Those little tips and tricks. We are going to hear today from one of our clients. She had surgery a month ago, yeah. And she found me pre-op because her doctor said, hey, go to this lady. She knows what she's talking about. Follow everything she says. Do everything she says to the T. So she did that. She came in, it was a week before surgery, with a bunch of questions all over the place, and we simplified it. Really, really nice, neat package for her. Things that she would need to get from CVS to help her, things that she would need to get from us to help her, and laying out the timeline. So this is the difference. This is where this comes in. You can prepare for surgery on your own, right? You can look things up, go down the YouTube, Instagram rabbit hole situation. You can look in the groups and stuff and see what other people are using and try to get that stuff ahead of time. But for your surgery specifically, and what you need specifically, is not what someone else, just because they had the same surgery, needs. Bodies are very different. Surgeries are very different. Circumstances, doctors are very different. So just Googling or going in a Facebook group, yeah, that's kind of helpful, but it can also lead you down the wrong path to purchasing the wrong things. So we're going to hear from her today about why she found me pre-op, why she came in pre-op, what the point of it was, and how it really helped post-op. So part of what we do in our pre-ops is set up your actual schedule for your sessions and explain to you what your procedure is going to be and what it's going to entail. And yeah, everybody's worried about how much pain am I going to be in, but it's not necessarily about how much pain you're going to be in. It's how to manage the little road bumps that would cause you more pain and avoid them. So, why did you come to me pre-op?
Great question. So actually my plastic surgeon recommended you after he told me to buy a faja online, and said, I'm not so sure about this. I need you to go to Ashley and see what she thinks. So I came to you. And you were like, oh, no, not that cheap one off the internet.
Not the Amazon brand.
Here. No Amazon brand. And I was fitted into one that would fit me for exactly what I needed with the swelling that was going to come post-surgery. You were able to answer all of my questions about what those first 3 days were going to look like before I came back to you, which was great because you were able to break down the healing process rather than this is going to happen, then this, then this, then this, then this, and all in once. It was broken into every little thing. So my question to you came exactly when you were ready to explain something else that was going to happen for me in a way that was positive instead of me getting all scared. At it, you were able to break it down and make me feel super comfortable with it, and I highly recommend coming beforehand because I didn't know what to eat, I didn't know what to drink. Little old me was going to drink some Gatorade right after surgery, and that was a big no-no. So it's really important to come and know what you should eat, what going to the bathroom is going to look like after, what the shower is going to look like, how to shower, what to use in the shower, and without you, I wouldn't know any of that. And also, without you, I wouldn't be healing as fast as I am right now, which is great. My plastic surgeon said, I'm almost a month ahead schedule, so because of all of the stuff we've been working on and everything, and the proper Faja.
Fajas.
Right? Fajas.
Garment, compression. We don't call them fajas because they're not fajas. We call them compression garments.
Oh,
That's why
compression
you're like, I don't know how to
garments.
say this.
I'm like, I don't know what it said.
Yeah.
But yes.
So, okay, that first day you came to me, what was like the most important thing that I said that you were like, oh my God, I'm so grateful she told me that?
Okay. I would have to say.
Because there was a lot.
Yeah,
It's a lot of information. That first pre-op, it's
honestly,
everything.
I think that you were able to break down all of my questions by each week rather than just answering all the questions on a piece of paper, like going on a YouTube or anything and like just seeing everything at once, like coming to you and breaking it down by like, this week we're going to work on X, Y, and Z, and like that's exactly where my body was at. And then when I came to see you week 2 and I had questions and that's exactly what my body was doing and et cetera, but like knowing beforehand like what to expect those first 3 days from surgery before I saw you was like super important because like I said, I would have been eating the wrong things in the wrong garment, swelling, expecting to shower day after, like peeing down my leg, like all of that would have happened if I didn't come to you. So
yeah. And you were sitting there with like a little notepad you had like 4 pages of notes by the time we were done with that first session, all the instructions.
yes.
Okay, so coming to me pre-op, obviously laying out the timeline rather than just giving you the information.
Yeah.
And then as far as like getting your supplies beforehand versus scrambling to get them afterwards, what would you say was like the most important part of actually setting you up for surgery?
Oh, well, I think buying the compression garment, having that ready to go, and also like having all the foods that I needed too, because I feel like knowing what I needed to eat and having that there, and also having the compression garments ready to go, and obviously brought to the hospital for the surgery, was super helpful to know.
Okay. And then, so this is another thing that we like, that we constantly go over every session. So going into surgery with what little information your doctor was giving you versus all the information that I was giving you, like how was it different, his pre-op versus my pre-op?
Okay, so good question. His pre-op was literally bring your compression garment to the hospital. Don't eat or drink anything for 12 hours prior. And then when you wake up, you're going to be swollen, and I'll see you in a week.
Okay.
And then, of course, he said, but that's not enough, so you have to go to Ashley. So then I came to you. It was 3 days before my surgery. Right?
Yeah.
I came to you on Monday, and my surgery was on Friday. And you gave me everything I needed. You fitted me for my proper compression garment because I was in the complete wrong one. Thanks, Amazon. And I love Amazon, but thanks Amazon. I didn't have the right foods. I had liquid IVs, I had Gatorades, like I had all the like normal sick foods that you would think you would need, which you don't want after surgery. And so you were able to break down like the types of foods and what I should be eating and what I should be drinking and how I should be getting up and walking around every hour and things like that I wouldn't have done. I would have just laid down and been in physical pain for an entire week unless I saw my plastic surgeon, because I wouldn't be coming to you. But now, of course, I'm coming to you because my plastic surgeon recommended it, and I love it.
Oh, you're so cute. I love you. All right, so the massage part of it, right? Tell me how that helped getting the massage before surgery. Like, mentally, emotionally, physically, like, what was the benefit of you actually coming to me to get them? Because when you came to me, you didn't know you were getting all this pre-op education.
No.
You were, like, ready to get on the table, and you were
Yeah.
like, all right, let's go. And I'm like, whoa. You did. You laid on the table, and I was like, hi, I have questions. Can we answer some questions? Thanks.
Yeah.
But, like, what was the benefit of getting the massage before surgery?
So I think when you Google like a lot of especially lymphatic massages, like you see this like squeeze approach, and you get all scared, and you're like, what is this? And like, this looks super painful. And so I was in for like, you're gonna squeeze my arm out, like, and squeeze the fat out of me, like. So seeing it beforehand, it really helped like my anxiety and nerves, and like it was not what I expected and not what I read on the internet and not what I saw online, because it's completely not that way, and if it's done that way, it's not correct.
Right.
So it was nice seeing what was going to happen post-op, pre-op, because you were able to identify like what you were gonna do to my body and like things like that, and like kind of prepare yourself for it post-op.
Like mentally ease the
Yeah.
anxiety of like, oh my God, what is this massage thing I'm about to go do?
Especially because post-op, like you're in pain, so you already like heightened anxiety, and so prior you're just like, okay, this is what she's gonna be doing, this and that, and then obviously after you like know what to expect.
Yeah. And then with like coming in pre-op, so like your doctor told you to come in, right? And he was like, hey, like go see her, she knows what she's doing, like trust her, do what she says to the T. But like, what were you most excited for coming in?
All my questions. I had like 24 on my
I know.
notes on my phone.
That's why I asked. She came in with like a whole
I think I
list.
still have them on there.
Do you really like the whole, all in the notes?
I do all my notes in my notes.
You're so cute. But yeah,
handwritten.
it was a
I
lot.
kept asking you for more paper.
Yeah, I know, it was a lot.
But it was good information, and like I feel like without it, I would have literally laid in bed for 3 days, 4 days, actually a whole week before I saw my plastic surgeon again, like in pain, not knowing like I need to be up, I need to be hydrated, I need to be eating chicken, like I need to be doing things, not like a sick person in bed who had just had surgery. Like you think of surgery and you think like laying in bed and recovering, and it's not like that at all, and you get up and moving and you feel so much better. And it's true because it's like every few days you really feel like a different person.
Yeah, and part of that is like the actual massages too.
Yeah.
So
Oh,
like
yeah.
let's
Well, every other day when I came here, well, not every other day.
Yeah,
but
twice a
week, it literally made me move.
Yeah. So let's talk about the actual massages part of it, right? So you were saying pre-op, you were doing your research for the MLD part of it, of the lymphatic drainage part of it, right? And you saw all of like the squeeze massage and the illegal stuff and like the rough stuff and like the scary stuff, right?
Oh, yeah.
So the difference between this and that, like for you in your mind, as far as knowing that like coming in pre-op, okay, now I know what this is, like I'm not going to get hurt here, I'm not going to be in pain here, like going forward with your sessions, having that pre-op knowledge, has that like changed your recovery? Like how you handle your recovery?
Well, I remember after like, was it the first massage post-op or the second? I was like, all right, this is helping me so much. Let's book you out for the entire next 2 months.
Next 2 months.
Like, whoa, I don't need you that many times. You're going to be way healed before then. But it just like, I felt like a different person. And every time I was coming, I was healing faster. And I was like I was saying before, like every 3 days like that I was seeing you, or every 4 days like I was like, oh my God, my arm's moving better, or oh my God, my stomach doesn't hurt when I do this, like, and it was just like a different, like I felt like a different person. And when I had to cancel that one session and then come, like even missing those 2 days, like I was in not pain, but like pain, if that makes sense. Like without it, you could feel yourself like missing that massage, like helping you heal.
The relief of like the swelling. It was like sitting on you.
It was like sitting in my limb.
Yeah.
If that makes sense.
It was sitting, yes, it was. It was
in my body,
literally
not
sitting in your
moving,
body.
because
Yeah.
I needed you to move it out of me.
Yes. Okay, so if you could tell everybody, like, what is the most important thing coming in for pre-op? Like, why would you want someone to come in pre-op?
Oh my goodness, the most important thing?
Or like all the important things.
Well, I feel like to answer all of your questions and to ease your anxiety. So like your plastic surgeon's great, right? Because you picked them to do your plastic surgery. But their job is to like suck the fat out of you or fix your boobs or whatever your surgery may be. But they're not there for the process. Once they cut you open and do what they need to do, they send you home as long as there's no infection or anything, and then you're kind of on your own. Like there's no like post-care. There is a quote online and it was like, once you have a baby and they send you home and there's no like post-care after your baby, you're just like on your own, like with a little crying baby. So like you're on your own after surgery, and like you're that like post-care nanny that like comes and take care of the baby, like to take care of you and like show you the ropes and answer every single question you have. Like, what do you shower with? Like, what lotions are you using? Like, how am I getting rid of this scar? Are my stitches healing well? Like, there's no one to answer, and you're not gonna like go to the ER every day or call your plastic surgeon. Like, I just ask you every question because you answer every question, because that's why you're there, to answer all of them and to be there and literally be your right hand healing person for as long as we need you.
Yeah, which would be until you're done.
Yeah, exactly.
And then you don't need me anymore.
Exactly.
I know.
But, yeah, I don't know. I'm just so happy, honestly. I could cry right now.
I know. Every session.
Because you really make such a difference. Like, really, I don't know how people do it without you. Because I can't imagine being at home in pain first, not getting a lymphatic massage if, like, someone's not getting it. And just, like, not knowing what to do to heal your body. And, like, without you, I wouldn't know.
Yeah, just like being
truthfully.
stuck.
Yeah.
Yeah.
You're, like, in pain, you don't know what to do, like, and then you think the doctor botched you, but really it's because you weren't getting your post-healing from you.
Yeah. Well, you did great. Yeah. You're still doing great.
Thank you.
So that's pretty much it. Our pre-op sessions can be done as far pre-op in advance or as close to. I mean, you came in 3 days before, and you were, like, freaking out because you're like, oh, my God, it's 3 days before. I'm going to die. And I'm like, I don't know about that. You're going to be fine. But, yeah, it's 3 days before. We got to get your stuff together. What did I think? I think it was the baby wipes that I told you about.
Yes! Oh, my God, I'm still using those. I still have them at work in my classroom just to have. I don't really need them anymore, but at first you do.
Yeah.
You need them a lot.
It's like those little
you don't
things.
Think about that at all.
Yeah, and that's what pre-op is for, right? So it's not like, okay, here's your list of supplies, go purchase them. Because we didn't even
I was going to say, I don't even think I purchased anything other than my compression garment.
You had your compression garment, and we didn't even do your foams yet.
Not yet.
We did everything step by
That's
step.
what I'm saying, every step, then the next one was the soaps that I needed, and the foams, and
the wound care. And the post-op cream.
And stitches and all that stuff. I mean, not stitches, but, like, care for that.
Well, that's, like, the point of the pre-op, right? So the point of the pre-op is not to be like, hi, buy this list of supplies. Hi, eat everything. Hi, do all these things.
Yeah.
It's, okay, here's our plan of action.
Yes.
Here is our step-by-step timeline of week to week, all the things that should be happening, how many times you're coming in, and what supplies and what education and what tips I'm going to introduce at that time to not overwhelm you. That was the biggest point.
That was my favorite. Yep, that was my biggest point. It wasn't just like, here's a giant list of everything, go get it, and this is what's going to happen to you week 2, and this is what's going to happen to you week 3. It was like, we were doing it together.
Yes,
like, you were
as
like
a team.
My nurse nanny, like showing me what to do.
Yeah, and that's the point.
Yeah.
And I mean, even post-op, right? Let's say you didn't see me pre-op. Post-op would have went the same way. It just would have been a lot more chaotic, and your mindset post-op would have been a lot harder to break through to get you, like, calm and on board with what's going on. Because even when you came to me post-op after, like 2-3 days after, you still had, like, all the questions.
Oh, yeah.
Like, what did he do? Where did the cannula go? Like, what is this? Is this normal? How do I use this? What do I do? And at that point, we introduced, like, step 2 of your post-op care plan. Like, the point of pre-op was to create an actual plan of action, not just dump information on you. It's to create the steps to get you to where you need to be.
And then tweak them based on, like, person and surgery and everything. So,
exactly.
Like, where, like, might have a plan, but then something might change a little bit, and then we work together on, like, what that plan was.
Like your garment, right? Because we expected you to be smaller sooner, but you weren't. So we tweaked that a little bit. We moved you to advanced foaming techniques. And then we got you into an even smaller garment. Yeah. So that's how that works.
Yeah. But we worked through it together, and you were there to answer all my questions.
Yes.
Swelling and everything.
And every little
going
patch.
Down. So quickly, it was like swollen, and next week it was like, whoop, falling out of the garment.
Yeah, the next week there was nothing left. But I think that's pretty much it. I mean, the point of our pre-ops is, like we said, to create a plan of action, to create a timeline plan of action for you guys, so that it's not just what you find on Facebook groups. You buy all this stuff, you don't know how to use it, you don't know when to use it. I think the thing that you were most excited about at the end of our pre-op was when I taught you how to put on the garment, and you didn't want to take it off.
Yes, I didn't know how to step into it. No one taught me even how to
like button it up. Yeah.
I think you asked me, you said, did your plastic surgeon teach you how? And I was like, well, no, he said he's going to put it on me while I was under the knife. And you're like, girl, you need to know how to put it on and off yourself. And I was like, teach me.
Yeah, please help.
Teach me. I don't know how to put a garment on.
I know. I think you walked around in here for like 5 minutes before you took it off. You were like, this is so nice. I love this. Okay. And I'm like, you got it. Come on. Come here. Got to take it off before you leave the room. But yeah, like little things like that they don't teach you, right? Like how to put on a garment, how to take off a garment, the proper way to put on a garment so you're not squeezing the life out of yourself. Little things every step of the way. But like our biggest goal in those pre-ops is to create that timeline and that plan of action, and then contingency plans for every road bump. So like, we weren't ready for the garment because you swole up a little bit, so we had to tweak it a little bit. But that whole like week 2 phase, we'd already talked about, okay, here are the goals we're trying to hit at week 2. Here's what we need to do in week 1 to get there, to get you to your healing at week 6 and be done. So that was kind of like the whole master plan of it, which is great because now you're ahead of schedule.
Yeah.
Like, your surgeon already said you're a month ahead of schedule.
He did. He was actually really surprised. He was like, there is no folding. There is no swelling up there. Your abs are coming in.
Yeah.
And I was like, you can thank Ashley for all of that. I just said that to him on Thursday.
But that's the point of doing the pre-op, is to be ahead of schedule, to get you, whether you're ready sooner or later, every single checkpoint, every single milestone, every single road bump, avoid all of it. You never had fibrosis.
No, I didn't, because I was coming to you twice a week.
Yeah.
No, literally, because I was coming to you twice a week.
You never had any fibrosis. Okay, so please explain to everyone that when you get lipo, no matter what your doctor says, no matter what you see online, fibrosis is not a normal occurrence. Does it happen regularly because people aren't taking care of themselves? Yes. Does it happen regularly because people are doing like squeeze massage and using machines and garments that are way too tight? Yes. But fibrosis does not have to happen to you. That is not something that has to happen. You never had fibrosis.
No, but remember I was like, aren't I supposed to have fibrosis? And you're like, no, baby, that you don't get it. You're not supposed to have it. It's because you're coming to me. And I like thought it was a normal thing because you read about it everywhere. It's not normal. If you come to Ashley twice a week for the first few weeks, like, you're not supposed to get it. I didn't get it, and I had lipo on my arms, my stomach, my flanks, and my thighs, and my back. Everywhere. Except for my upper back.
Yeah.
Literally, and no fibrosis anywhere. Like, come consistently, follow what Ashley's telling you, because I'm telling you, it works.
Well, it was more so too, we got the foams in you like right away.
Yeah.
We got the foams in really early, and the foams are what prevent the fibrosis to begin with. Like, you never even had any of that.
No. Well, I came to you before.
Yeah.
And then I came to immediately after and followed. And I've been driving 60 minutes twice a week to you. Yeah. Just because
you gotta get it.
I feel healed with you, like, doing it and like being here. Like, I know that you do what you do for a reason, and I see it, and I see it on your Instagram, but I also see it from me. Like, as a perfect example, like, I didn't get any fibrosis. I didn't get anything. My healing went down on my abs, which was supposed to take 2 months to even see abs.
We're at a month.
Literally, it's a month post-op.
Yeah, it's a month on
and like,
Thursday.
I have abs.
Tomorrow's a month.
I'll be ready for the batch. Not my batch.
Not her batch.
My friend's batch.
The batch. The big batch that we're preparing for. But yeah, you never had a seroma. You never had fibrosis.
I don't even know what a seroma is, but keep going.
Exactly. You don't even know what a seroma is. There you go. No, but you never had any complications. The one thing that your doctor was a little worried about was like that tiny little patch of swelling.
Oh, yeah.
And then you came to me, you're like, my doctor's worried about this. Should I be worried about this?
It was gone in 2 sessions.
It was literally gone in 2 sessions.
Yeah.
And that was it. Skin retracted perfectly. We didn't have to wait for anything. Everything cleared right up. Yeah, you never had fibrosis. You never had any complications. But that's because we started you early with everything. Yeah. We started you with the diet and making sure your lymph system was healthy and working.
The second I went to surgery, even 2 nights before, you said, start the juices, and I did.
Yep.
And
gallon of water.
It made such a difference.
Cut the caffeine, gallon of water, start the juices 3 days before surgery to start priming you. And then,
that's exactly what I did. I drove home that day.
Yes, you did.
Went straight and got greens.
Yeah. But
me and my mom drank it with me, too.
Even your incisions, they look like freckles. And you're only a month out. You've had no complications at all. You don't even know what a seroma is.
No, I don't. I'm like, I Googled what fibrosis is, but I didn't have any.
I know. That was funny. You came in and you're like, am I supposed to have fibrosis now? And I'm like, what? No. What are you talking about?
Because everyone gets it, because
I know.
No one's coming post-op or pre-op to see you.
Yeah.
Or people who are.
Well, they come post-op, and usually people find me when there's a problem, right? So your doctor gets into this thing where they tell you, oh, it's normal wait a month. Oh, it's normal wait 2 months. Oh, it's normal wait 3 months. Oh, it's normal wait 6 months.
Don't wait.
Yeah, you wait a very long time, and you got right on it. Did he tell you beforehand to look for massages?
No, he gave me a printout with your name on it.
Ah, okay.
Printout that said lymphatic massages, you, and then someone else somewhere, and I googled it, and it looked kind of like a squeeze massage, and she didn't look certified, and I was like, oh, Ashley has all these degrees, we're coming, we're driving an hour, and I made my mom drive me an hour here, and honestly, and you're like the only one in New Jersey that does what you do.
Yeah, so this
Truthfully.
degree, anyway. Everybody else
Yeah.
is like, you know, there are some other lymphatic massage therapists here, though, that are really good, but they're not here. They're like an hour away. They're like not near us. But yeah, that's pretty much it. I mean, do you have anything else you'd like to tell the people about pre-op or your surgery experience as far as
pre-op with Ashley, and if you can't get your pre-op because your surgery is now, then come after. Don't wait, like you said. Like, don't wait. Like, come in, because Ashley can help you as soon as you're here. There's no reason to wait, because I know they say it could take 6 months to a year for healing and this and that, and that's great and all, but wouldn't you rather fix it now or go through what you're going through now than wait a whole another 6 months to a year? I think that's everything.
Yeah, I think that's it. Okay, one last thing. What was more beneficial to you? The actual pre-op education information, same thing with post-op education information, or the actual massages?
Oh,
what do you think was more helpful?
I think I liked your information. Like, I liked the massage too, but I think the way you were able to break down everything and make it less overwhelming and fit me into the right compression garment and talk to me about proper eating and what it's going to look like when I get home from surgery the first day and what I should do and how getting into bed is and how to get out of the couch. Like, I wouldn't have known none of that. And I feel like without pre-op, I would have been like even more stressed than I normally am on an everyday occurrence. But like, felt like I remember leaving with my mom and I'm like, oh, that felt so good. Like, I felt like I learned so much from you in the hour, like, of like what it's going to look like and how to break it down and the schedule of what the next visit was going to be and like what to expect those first 3 days, rather than like waking up from anesthesia and leaving the hospital and saying like, see you in a week, doctor. I love my doctor, but I'm just saying, like,
yeah, he's
I
fantastic.
couldn't do it without you.
Yeah. And then even like the post-op information, right? Like, I don't think there's a single session where we're not like digging through your life to figure out what's going on.
Every time.
I know. And it's always like, I look at you and I'm like, okay, so here's what's happening. Before you say anything, here's what I see. This is why, this is normal, this is okay, you're okay. And then you're like, okay, because I had this thing and I didn't know and I was so worried and I just didn't know. And I'm like, okay, let me explain to you the science of why the thing. And then you're like, oh, really? And I'm like, yeah. And you're like, oh, then it's fine. And I'm like, yes, it's fine. It's okay. But that's your whole journey. Like, you need that support your whole really post-op. Like, it's not just...
You do. Because you're not alone during it. You need to be with someone. You can't just do it on your own.
Yeah, but I mean, not every massage therapist is to the level of post-op where they have all of the information and the protocol and all of that. And that's the difference, right?
Yeah.
So,
no, absolutely.
Yeah. But you're doing great, baby.
Thank you.
I love you.
I love you too.
So that's about pre-op and all of that and what you should be doing pre-op. So basically, let's wrap it up. You need to find someone to be on your side. I do virtuals for pre-op. I do in-offices for pre-op. But you need someone who's not just going to be like, okay, buy these things. You'll be good. You need someone to actually explain to you, which is why I do these videos and why my lovely lady graciously agreed to do this video, because you need someone to explain to you and break it down literally in a timeline. Okay, each week, here's what your body is going through, because it's changing. Your body is changing in real time because of surgery. Your body's healing in real time because of surgery, and there can be road bumps, there can be hiccups, and you have to have someone help you, like she said, show you the ropes and how to navigate those things while you're in pain and trying to heal. That's a lot to do on your own. So the benefit of a pre-op is getting that established beforehand, so that when the crazy things do happen, you know, okay, Ashley said it's fine. She explained to me why it was fine. She explained to me the science of why it's fine, and now I know how to deal with it. Now I know how to fix it, and we're good to go. So that's the same thing we do in our post-ops, but pre-op is a lot cleaner, calmer, You're more prepared.
You're
Not in pain. The little tidbits of like the little things for you to pick up, like the baby wipes when you can't shower, properly fitting you for a garment before you just wake up in one, teaching you how to use it properly, right? Put it on and off. That's what pre-op is for. That's why you'd want to get a pre-op session with whatever, even if it's just like the therapist that you're going to be working with just to do your MLD, and they're not a plastic surgery recovery specialist, and they're just a therapist, right? Even if it's just that, doing the MLD to experience it beforehand so that you know what you're getting into. Because if it is a machine squeeze massage situation where they shouldn't be doing that, wood roller, hard pressure, and it hurts before surgery, imagine the pain you're going to be in after surgery. If it hurts before surgery, it's going to be worse after surgery. So definitely going before surgery and finding someone who does lymphatic drainage or manual lymphatic drainage, whatever they're calling it, somebody who's actually doing the Vader hands-on technique so that you can understand what it's supposed to feel like, how gentle it's supposed to be, where that person's going to be working in relation to your surgery, and talk to them. Do like, a pre-op session of massage beforehand so that you can kind of understand it. Because when you got off the table, you were like, that's it?
Yeah.
And I'm like, yeah. You're like, are you sure? And I'm like, yes, I'm sure, that's it. And you're like, oh, that was so nice. And I'm like, oh, yeah, I'm not going to beat you up, I'm sorry. Like, and you're like, really? And I'm like, yeah, that's it. What do you mean, really? And then every time after that, she's like on the table, ready to go. When you walked in, you were like, okay, let's go. Like, I want to get this over with.
Sometimes I take the garment off before, and you're like, no, I want to see how it's fitting.
Yeah, you're like already like unclipping, and I'm like, oh, hey, we gotta wash hands and things, but also I need to see what the garment looks like. We gotta check everything. Slow down. But you guys need to start dipping your toe in the water before you get emotionally worked up, before you're in pain, before you're after surgery, you don't know what's going on. Guys, even something as simple as purchasing an Amazon garment, right? You didn't try yours on.
Nope.
You didn't even think to try it on until I told you, hey, try this on. Because if it's too big now and you're having liposuction, it's going to be too big afterwards. Yeah. So things like that, to have somebody there to think of all the things for you that you don't really think of, somebody that's outside of it to take care of you, that's in that right mindset all the time, that's what our pre-ops are for. But even still, you guys don't want to do a pre-op with me, that's fine. But pre-op research, right, is not just Googling, like you said, because you found a lot of lies on Google. Mm-hmm. Pre-op research is actually putting on the faja before surgery and seeing exactly how big it is to make sure it's not too big. It's buying the supplies and trying them, right? It's buying the post-op cream or the soap and seeing how it feels on your body before surgery. It's going to get the massage before surgery so that you know what you're walking into and you're not scared. It's starting to eat the right things and prepping your body. But you have to actually start doing these things well before. I mean, you only had 3 days and you did fine. You were on it with everything 3 days before. And those are the most important days. Yeah. Anyway, because they're like right there. And then you're seeing your doctor and everything. But that's the importance of pre-op. It's not just, being able, like us, we go overboard. We lay out the whole timeline. We tell you exactly when to start using what and how to use it and when to use it exactly at the time that you're using it. And when we need to take those next steps, we take them together. But you guys have to start doing that pre-op experimentation, I guess you'd say, beforehand. So that's all we wanted to talk about. I love you.
I love you too.
You know that. You're amazing.
Amazing.
Be sad to see you go. But that's it. Pre-op. Call the office if you need a pre-op. Happy Alex, who you adore.
I know. Alex knows me by my first and last.
She does. Alex knows you by your phone number.
All the time now. I have my telephone number.
Alex knows your number. She picks it up. She's like, hi, Rachel. How are you? Hello. How you doing? But yes, call the office. Happy Alex will be great. And as she always is, she'll be happy to set you up with an appointment. She'll answer any questions that you have even before the appointment. I think she did that with you, too. She spent 20 minutes.
I was going to say, 20 minutes on the phone with her just talking about what this was, which office was the closest to me, and making an appointment. Like what was included, because I read the transcript afterwards. I was like, damn, that was a long conversation. But Alex will spend 20 to 30 minutes. She'll spend the time on the phone with you to explain to you what's going to happen in the appointment, the benefits of it. She'll ask you about your surgery, what you're having done, so that I have notes on it. So give Happy Alex a call, 732-841-0142. And this is Ashley with Amare, and I will talk to you guys soon. Bye.